Thank you all so much. And I have a few questions for our panel. And I think we are saving audience questions until later. But if you have a burning question, please raise your hand. So I heard a few themes from among these different perspectives that I just wanted to pull forward for purposes of conversation. And a big one was one that Derek ended with, and that is the huge power that lies in the alignment of shared values. When something is in the interest of a business from its perspective of a business bottom line, and that interest aligns with the kinds of health outcomes that we in this room spend a lot of time talking about, that is where we can hope to see, I think, the greatest success. We also heard a lot about the role of data, and I think data can be our friend and data can be complicated. So how much data is enough, et cetera, is an important question. And finally, there's a huge diversity of business, obviously. We've got nano businesses, we've got major multinational corporations. To say that no one size fits all would be probably the understatement of the year. So I want to just start with data, kind of the building blocks of this, and go to Ralph first. So you talked a lot about the drivers for the businesses that are your constituency: retention, productivity, competitiveness with other cities. And my question is, you've got a study that gives them good information at the kind of regional population community level about health, but you also said they care about ROI, they care about what does this mean for me. How do you get from a sense of what it means in the community to what it means for that individual business person, that decision maker who's got to make investments based on some data? Are they making investments now based on what you've got, or is there a gap that needs to be filled?
Well, at least in our experience, the first thing they needed to understand is kind of the competitive environment. The businesses know that they're in competition for workforce now, that the workforce needs and the job growth aren't aligning, matching up, and they've got to have retention, loyalty, et cetera. So the first thing they really want to try to understand is they want legitimate data about the community. Now, I have to tell you, they don't need to know the fine detail, but they need to be able to trust the data. So when the what the FTI study did was it said, here's a credible methodology, here's a credible source of the data, here are the conclusions that have been reached, and that is that we're subpar performance in these three chronic categories. And here are the assets that are available to deploy against that issue. Businesses need to know that that opportunity exists, because then they're willing to take their own incremental resources and pledge them to the effort of their employees and their population. So I guess what I'm saying here is that they need to know the general community data first, but then you need to dig deeper, and that's why a stakeholder like Blue Cross Blue Shield is so key, or the continuing granular reaches on the FTI study are important. You need to reach deeper into their particular workforce, because they know a 28% improvement or an improvement in presenteeism is going to generate a real productive return. And if they can retain that healthy employee, they're getting a payoff, an ROI that lasts for years.
Thanks. Alex, I'm going to pick up on that theme of sort of matching the problem statement with the assets at hand and how that informs businesses' decision making. So when you look at small and mid-sized businesses, you talked about cost. Cost comes up frequently, as it should, in terms of what's a driver for decision makers in small and medium-sized businesses in particular. And so my question is, I know you put together a toolkit that had low and no cost solutions. I wonder if you could talk a little bit more about what that looks like. In my line of work, I run into a fair amount of skepticism about, is this really low and no cost, and really are they going to do it? So one question is, what are some of those solutions? What do they look like? And the second question is, the other barrier we hear a lot about when it comes to small businesses is not just cost but bandwidth. People are maxed out. They are working hard at their day job. There is no HR department. There is no evaluation process and cycle of feedback and retweaking of resources. We're, kind of on the front lines here. So how do you all think about that bandwidth issue as well?
Those are two very key points in what we've done and what we continue to do with small to mid-sized employers. In terms of what the solutions are, and in terms of whether or not as low cost or no cost they're effective or impactful, what we have found to be key in terms of our focus with organizations and building infrastructure and processes at the organizational level to support health improvement, not just with employers, but we also do the same thing with college campuses, is looking at what policies and what infrastructure could be changed or needs to be changed in order to result in those outcomes that we're hoping to get to. And so the first pass for us, especially with SMEs, has been what are some of the policies that you can put into place that would be effective, that have demonstrated impact, and that would propel your work around supporting employee health forward. And a lot of those are specifically related to culture. How do you build the culture of health that everyone wants, that new employees are attracted to, that your current employees will be sustained and fed and feel that their needs are supported. And so walking them through even something as simple as creating an organizational mission or value statement that speaks to the integration of health, to productivity, to effectiveness, to whatever the mission is of that organization or employer. And it doesn't have to be altruistic, but we do walk them through that kind of integration of both business support and services and function, and then health, and how that's all tied back together. And so a lot of what we offer right now in terms of support and guidance and building that type of institutional infrastructure is around policies. And then the second part is really looking at what are the no-cost or low-cost interventions that can be done. For physical activity and nutrition, I think physical activity is one in which there's probably more no-cost or low-cost interventions. There are things like instituting mindfulness breaks, or things like instituting walking meetings, or things that institute even creating or linking to outside sources. If your office or your complex is located in a business park or adjacent to a park, it's actually creating connections, whether they be physical, which may involve some cost, or just providing communication around the resources that exist in order to be active. And there's also smaller things that I think most people are aware of, like including well-lit staircases if you have a multi-story building, and painting them in neutral colors or pastel colors to actually incentivize and just mentally prompt people to use them as opposed to just hopping in the elevator. So it's a compendium and a collection of those types of no-cost and low-cost intervention methods, and one, to be quite honest too, in which we're looking to expand. So as new solutions or interventions that have demonstrated impact are brought to light, we're more than happy to incorporate that into the toolkit going forward, because it is meant to be expansive and to be iterative. And then the part about bandwidth is something that quite honestly comes up in our meetings and our conversations with SMEs. And that's where I think the Clinton Health Matters Initiative and the Foundation sees its role and its ability to bring value to the discussion, which is we can be that backbone organization. We can literally give you templates as to if you need to present to senior leadership or if you need to make a presentation to your employee population, we have those types of toolkits. They are white labeled. They can be branded with your organizational branding, or we can provide the branding, whatever makes the most sense given who your audience is. And that's also where we can provide the infrastructure around assessment and evaluation, because we can bring 10 organizations, or in most cases we're working with about 30 organizations in each of those communities. We can bring them together to say, okay, you're looking for X, organization or employer Y has that, and connect that and then share that across the different organizations that are participating.
Thank you. And I'm going to ask Derek the final question, give him the last word. There's been so much movement in this area in the last 4 or 5 years since I first met you. And my question is, based on what you know, we've seen changes, we've seen reformulations, we've seen changes in the checkout aisle, we've seen adjacent actions like you described, we've seen beginnings of wearables and their impact on consumer behavior. Given what you know about what drives business decision makers and the beginnings of changes that we're seeing, my question is, where do you think we're going? When you look out 10 years from now, is there a particular type of activity or a particular area of alignment that you think holds particular promise and where we could really see change on an order of magnitude that's even bigger and different from what we've seen to date?
Thanks for that really, really simple question. In the next 2 days, let me give you a couple of... I think if you cut through it all, I think what I think we've learned, and some in this room, particularly Nico and us, have also thinking about it, goes to a question of what has been the reason that the environmental movement has really succeeded, not just in getting visibility, but in getting serious corporate engagement. Why is it now that the evidence is very clear that the profitability of clean energy companies is soaring, that the size of the actual investment is starting to go up dramatically, obviously at a time of critical need in terms of climate change? What is it that we in health and the obesity world could be doing at that level? I'm not going to speak to what governments can do because who knows what governments we're going to get. But within the corporate world, it's very clear that what the environment folk had was the attention of the chief financial officer and the CEO in terms of the financial reports, no longer just focusing on financial reports, but focusing on what is called ESG reporting, environmental, social, and governance reporting, which has now become 10, 15, maybe 20% of what investors are looking at. Our view is that we need to have health included in the integrated financial report of all companies, particularly those companies who are both contributing positively or or less positively to some of the underlying drivers of obesity and health. But for every company, we should be reporting on the employee, this health status of employees in some way, given that the health status of employees is probably one of the major drivers of productivity, morale, and retention at work, often exceeding that of plant and machinery, which is reported under the SEC and in their people's 10K reports. How many companies report on the health status and the driving concerns that obesity will have for the long-term profitability of a company, despite it being material to the company? That, I think, once that happens, it's a lever at a very high level that has impacts both in terms of how we accelerate the work that Alex is doing on workplace health, but also how we actually reward those companies that are making the significant steps forward in changing their basic products and services to address obesity.
Thank you. I think that concludes our session, and thanks all of you for participating.